This video is for the J-stroke manipulation for the foot ankle. The scientific explanation for this technique is as follows. This manipulation is a talocrural joint distraction manipulation combined with a posterior thrust causing a scooping movement to occur. The purpose of this manipulation is to create a sudden distraction force at the talocrural joint while simultaneously providing a posterior or dorsal force in order to gap the talocrural joint in order to restore the ability of the talus to laterally rotate at the end range of dorsiflexion. With ankle injuries, especially inversion ankle sprains, the talus will adopt a medially rotated position within the ankle mortise, which may go unnoticed to the patient but will prevent the individual from reaching full range ankle dorsiflexion. As with normal physiological motion, the talus must laterally rotate in order to gain the last degrees of dorsiflexion. This manipulation is a combination of a talocrural distraction manipulation with a specific posterior thrust and was intended to be used in cases where the talocrural manipulation was unsuccessful. The explanation of this technique in layman's terms is as follows. I will be performing a technique on your ankle that is going to help you be able to pull your toes towards your knee, as well as allow you to squat down further with your foot flat. For this technique, I will be applying a force to create more space in the ankle joint, while also providing a thrusting force through your ankle in a step-by-step instructions for the J-stroke manipulation are as follows. Step 1, you're going to have the patient lay in supine and bend up the leg that is not to be treated, and leave it on the table with the foot flat to protect the lumbar spine. Step 2 is, as the physical therapist, you want to place your body in line with the leg to be treated. In this case, Sarah's left leg. Step 3 is the physical therapist is going to grab the patient's foot such that the thumbs are on the plantar aspect of the foot with the middle or ring fingers around the neck of the talus and the hands overlapping. Physical therapist then is going to just bring the patient's foot into dorsiflexion and plantar flexion to get a sense of the motion. Next, you want to make sure the patient's foot is in the resting position for this manipulation, which is about 10 degrees of plantar flexion. Next, the therapist will pull into gentle distraction at the ankle joint, ease up to about half of it, and then apply a thrusting force or provide a distraction force while simultaneously dropping the body weight to provide a posterior force. I will now perform the technique. A positive result would be when you re-perform your range of motion testing, the patient would have full range dorsiflexion.